Hello and welcome to the 2019 Open Enrollment Retiree presentation. My name is Melanie Denning and we appreciate your taking time to listen today. Since you are listening to a recording, there's no need to sign in. You should have received a postcard detailing the locations and times of the live open enrollment presentations and how to access the recorded presentation. Live retiree sessions will be held across the state, including Anaconda, Billings, Bozeman, Butte, Great Falls, Kalispell, Miles City, and Missoula. There will also be 2 sessions held in Helena. After October 2nd, a retiree may view the recorded presentation on the HCBD website as an alternative to attending a live presentation. Retiree open enrollment books will be mailed the week of October 15th. Open enrollment will be held October 28th through November 10th, and retirees who wish to make changes to their state plan benefits, including re-enrolling on the Vision hardware plan, must complete their open enrollment elections by November 10th, and will do so online this year. Retirees will not receive paper election forms this year and will instead be directed to complete the open enrollment election online. Retirees will have the ability to request a paper enrollment form by contacting the HCBD or Healthcare and Benefits Division. More information will be provided in the next 2 slides. Remember, the State of Montana Benefit Plan or State Plan is self-funded. The State Plan is funded by monthly employee, legislator, and retiree contributions. The contributions are held by the state plan and used to pay state plan expenses, the vast majority of which are claims. In 2016, transparent pricing, also known as reference-based pricing, was implemented and allowed us to control the cost of healthcare while maintaining quality, predictability, and fairness. We call this new way of reimbursing providers transparent pricing. But it really was the introduction of what many in the healthcare industry call value-based care. In 2017, we saw medical trend, or expenses, decrease, coming in at $130 million compared to $137 million in 2016. Last year, in 2017, Navitas became the state plan's pharmacy benefit manager. Navitas allows for a full pass-through, transparent pricing model that ensures the state plan receives all rebates and reimburses pharmacies the exact amount paid by the state plan. In 2017, we saw prescription trend, or expense, decrease, coming in at $25 million compared to $32 million in 2016. Dental-related expenses remained stable at $8 million. And when you balance our income with our expenses, you get the state plan reserve. State plan reserves are needed because we can't always control all the variables surrounding and operating the state plan. We are able to control many of our plan costs, but there are some things we don't have direct control over, including our largest income source, which is the employer contribution. The employer contribution is set by the legislature every 2 years, and HCBD provides funding recommendations but ultimately has to comply with funding set by legislature. The employer contribution has not changed in 2 years and will not change for employees in 2019. Federal mandates also directly impact state plan expenses. For example, last year, the state plan was required to cover statins, which are cholesterol-lowering medications, at a $0 copay due to the Affordable Health Care Act, or ACA. HCBD works hard to estimate and evaluate expenses so that we have a general idea of the volume of claims in a given year, but there can be surprises. Medical trend, which is the increasing cost of medical care, is a huge variable to the state plan, and we have little control over it and it can be difficult to predict. Cost of medical procedures and prescription medication continues to rise year after year. For example, year to date, the state plan has seen a dramatic increase in the number of large claims this year, as well as the dollar amount associated with large claims. This year we have one claim over $2 million and 3 others over $1 million. The state plan needs to always have enough money in reserves to cover all 30,000 members when they need us. As noted on the previous slide, HCBD is progressive and works hard to develop and implement cost-saving strategies to keep the employer, employee, legislator, and our retiree contributions stable. The combination of all the cost-saving actions, the transparent pricing, the Navitas Pharmacy Benefit Manager, the new Medication Therapy Management or MTM program, increased efficiencies at the Montana Health Center, have all allowed HCBD to minimize the financial impacts to all state plan members over the last few years. While progress has been made and money has been saved, now that we are more than 2 years into transparent pricing agreements with hospitals, HCBD believes there's an opportunity to do even more to control costs. So we're going to be asking our hospital partners to look even more closely at the pricing, and we ask that you as state plan members look at any care that you might have outside the state and, if appropriate, consider keeping it with our in-state partners. HCBD will continue its efforts to control costs and manage the state plan, continuing to work with Montana hospitals and other partners to address rising costs of health care on behalf of all state plan members and state of Montana taxpayers. In 2018, the state plan was able to offer a 0% rate increase. However, for 2019, the state plan must increase retiree rates due to larger than anticipated claims, both volume and cost. The increase for 2019 in most cases is less than double digits and is lower than the market's current medical trend. Non-Medicare retirees will see an approximate 9% change depending on who they cover. Medicare retirees will see approximately 2% change depending on who they cover. The Department of Administration and Healthcare and Benefits Division will continue its efforts to control costs and manage the state plan. And we will continue working with Montana hospitals and other partners to address the rising costs of health care. This slide reflects the rates and the rate increase for the medical plan for non-Medicare retirees. This amount is shown in your booklet. This slide reflects the rate and the rate increase for the medical plan for Medicare retirees, depending on who you cover. This slide reflects the rates for dental, vision, hardware, and basic life. These plans have a 0% rate increase for 2019. Retiree rates have also been included in the Retiree Open Enrollment booklet and have been posted on the HCBD website. As a reminder, once you become Medicare eligible, you must enroll in Medicare Parts A and B, and you will be automatically enrolled in the state plan Part D coverage. You cannot sign up for any other Part D coverage, because if you do, you will not be allowed to stay on any state plan benefits. Healthcare and benefits will require proof of your Medicare enrollment, and you will be automatically charged the Medicare retiree rate. Your monthly rate is reduced when you become Medicare eligible because the state plan will become secondary coverage to Medicare. Once you become Medicare eligible, make sure to contact HCBD with a copy of your information. We are pleased to announce that there will be no change to the medical plan out-of-pocket costs. That means that medical plan copays, deductibles, and maximum out-of-pocket costs will stay the same for 2019. You can refer to the Open Enrollment booklet, the HCBD website, or the WRAP plan document for additional state plan coverage information. When you retire, you have the option to stay on the state plan, but there may be other options that may be more financially beneficial to you than staying on the state plan. This includes the health insurance marketplace, which you can find at www.healthcare.gov if you're under age 65, or Medicare supplements or Advantage plans if you're over 65. For more information on these options, you can contact a state health insurance program or SHIP representative in your area by calling 800-551-3191, or contact the Agency on Aging through the Rocky Mountain Development Council statewide at 406-457-7368. These are both excellent resources of information. This year's Live Life Well incentive deadline is October 31st, 2018. Don't miss out. Hopefully you've already completed your state-sponsored health screening, and we have sent many reminders. This year, remember you must complete all 3 requirements to earn any of the incentive. Once you complete a health screening, it will be automatically reported on the MyActive Health site. It takes about 1 month from the date of the screening to show up on the site. However, to earn the incentive, you must also self-report the nicotine status and the next step activity on the MyActive Health site. Even if you did a wellness challenge like Governor's Stay Active Challenge, you still need to report it on the MyActive Health site to earn the incentive. And if you're not nicotine-free, but you tried an alternative like a nicotine cessation program, you must self-report that as well. You should self-report your nicotine status and your next step activity as soon as they're completed. You do not need to wait for your health screening activity to show on the website. If you qualify to earn the Live Life Well incentive, but you do not have internet access, please contact the Healthcare and Benefits Division for more information on how to manually report your information. Additional instructions are available at the benefits.mt.gov website. If you're ready to self-report, you can go to myactivehealth.com/state of Montana. But if you have any questions at all about the Live Life Well incentive program, first start at the benefits.mt.gov/incentive page for complete instructions. If there is a medical reason that you can't do any part of the Live Life Well incentive, there are exceptions and alternatives available. Please call Healthcare and Benefits Division to learn more. You have a handout available to you on our website. The Live Life Well program restarts November 1st, 2018. The 2019 Live Life Well incentive program will be exactly the same as this year. Information has been included in the open enrollment booklet and on the HCBD website, which will be updated with next year's program information after October 1st. This year's open enrollment period runs from October 28th to November 10th. This year, all state plan members, employees, legislators, and retirees will complete the open enrollment election online or via a mobile device. The open enrollment booklet will contain important information you need to know about completing your benefit elections. The booklet will be mailed the week of October 15th, and the open enrollment system will open for enrollment starting October 28th. If you do not have internet access, or you would like to manually complete your open enrollment elections, please contact the Healthcare and Benefits Division. All open enrollment elections must be completed by November 10th, even if you elect to complete your election manually. During the open enrollment period, you can make changes, or you can waive the state plan coverage, or you can also add or delete dependents from the plan. This is also the time to elect or re-elect the Vision hardware plan. The Vision hardware plan will be terminated effective January 1st, 2019 if you do not complete an open enrollment election. Again, if you don't complete open enrollment, you will have the same medical and dental coverage that you currently have, and basic life if you happen to be eligible. If you do not complete an open enrollment election, you will not be enrolled in the Vision hardware plan, even if you had the coverage in 2018, excuse me. If you do not wish to make any changes to your current coverage, or if you don't want to elect or re-elect the Vision hardware plan, you do not need to do anything during open enrollment period, and you do not need to complete anything online. However, remember, if you don't complete 2019 open enrollment election process, you will have the same medical, dental, and basic life coverage for yourself, domestic partner, spouse, or dependents in 2019 that you elected in 2018. You won't be enrolled in the Vision hardware plan unless you complete the open enrollment election. So if you have any questions, please contact the Healthcare and Benefits Divisions at benefitsquestions@mt.gov for an email or a phone call at 1-800-287-8266. All elections are due November 10th. Big changes are ahead. Healthcare and Benefits is implementing a new benefits enrollment and administration system called Business Solver. This will replace the paper enrollment process used for retirees in years past. The Business Solver system will be used for the 2019 open enrollment by all state plan members, including employees, legislators, and retirees. With the new Business Solver system, the state plan members will also have the ability to complete open enrollment elections on mobile devices. Login instructions are included in the open enrollment booklet, and the link to the open enrollment system will appear on the HCBD website when it's ready on October 28th. Business Solver will also be assisting the state plan with monthly billing and collections. If you self-pay your contributions via check, you will receive your annual coupon book from Business Solver, and payments will be sent directly to Business Solver. Watch your mail for your coupon booklet because it will look different. If you pay your contributions via electronic fund transfers, these transfers will continue to happen into 2019. If you pay your contributions through your Impera or TRS retirement check, those contributions will continue to be withheld and sent to the state plan. Contact Healthcare and Benefits Division if you have any questions regarding billing. Starting January 1st, 2019, you will be able to use the Business Solver system for all state plan enrollment needs. For example, retirees will be able to use the Business Solver system to complete their initial retiree enrollment, mid-year enrollment changes if that applies to you, request a termination, or update your address or your beneficiary. The new Business Solver system is very user-friendly and easily accessible. To access the new system, you will go to benefits.mt.gov and click the Open Enrollment picture. Once you click the Open Enrollment picture, you'll be prompted to register. Since you will be a first-time user, click on Register. Once you click Register, you will be prompted to set up a username and password and answer security questions. The state plan's company key is State of Montana, lowercase, no spaces, and will already be filled in. It is case sensitive. When you complete your registration, you will be asked to consent to electronic signatures. This will only happen the first time you access the system, and after you click Continue, Continue, you will be transferred to the home page that will be available to you each time you access the system. Once you're transferred to the home page, click on Start Here and follow the instructions to complete your open enrollment elections. You must complete your open enrollment elections by November 10th, and the system will show you the time you have remaining to complete your enrollment. Once you begin the open enrollment process, you will be prompted to review the personal information on file. Please make sure that we have your correct contact information and on file, or update it if it's needed. The next section is for dependent information, and it allows you to make dependent information changes and to add or delete dependents. If a dependent is listed on the dependent information page, you as the member will be able to enroll that dependent on state plan coverage and the enrollment tabs that follow. You will then click through each benefits section, electing or waiving the coverage, and then also selecting dependents to be enrolled. This is a screenshot of an example of an active employee's available benefit options. Yours, as a retiree, will be limited based on the benefits that you are eligible for as a retiree. If any additional action steps are required based on the elections that you make, such as dependent verification or evidence of insurability, you will then be prompted to complete that action that is required. If you are unable to complete the action at that time, you can click Next, and the system will remind you at a later date that there is an outstanding action required in order to complete your enrollment election. Once it's complete, you will be taken to the confirmation page, and you can print a copy of your election by clicking on the Print Benefit Summary button in the top right corner of the screen. This message center will house a copy of the confirmation notice, and the message center will also be used to provide you with other important state plan communications, such as reminders about dependent verification or evidence of insurability. You will receive a postcard when your 2019 benefit summary has been finalized. However, you can access this same summary at any time by logging into Business Solver system and clicking on Benefit Summary. Watch for the postcard and go online to verify that we have enrolled you correctly for 2019. During and after open enrollment, there are other important documents that will be coming from Healthcare and Benefits Division, including the WRAP Plan Document, or WPD, which outlines everything covered and the plan details. You will also receive a summary of benefit coverage, which is a legal document required by the Affordable Health Care Act, and it's a short summary of our plan. You will receive Medicare Part D creditable coverage letter and a few other legal notices. Feel free to contact the Healthcare and Benefits Division with any questions or concerns at 800-287-8266 or email us at benefitsquestions@mt.gov. Thank you.